This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, October 21st, and I'm Zach Caruso. Our lead story this week is in JAMA Network Open and is titled Alcohol Consumption Per Capita and Suicide, a Meta-Analysis. This meta-analysis that included 13 studies assessed if alcohol consumption per capita is associated with suicide mortality, and if so, does the association differ by sex? Researchers found that a 1-liter increase in alcohol consumption per capita was associated with a 3.59 increase in the suicide mortality rate. There was no evidence of a sex difference in this association. These findings suggest alcohol consumption per capita may be a useful target to consider within comprehensive national suicide prevention strategies. Next is an article in BMJ Evidence-Based Medicine titled Alcohol Use and Risk of Dementia in Diverse Populations, Evidence from Cohort, Case Control, and Mendelian Randomization Approaches. Researchers conducted prospective cohort and case control analyses combined with linear and nonlinear Mendelian randomization to investigate the relationship between alcohol consumption and dementia. The findings provide evidence for a relationship between all types of alcohol use and increased dementia risk. While correlation observational data suggested a protective effect of light drinking, this could be in part attributable to reduced drinking seen in early dementia. Genetic analyses did not support any protective effect, suggesting any level of alcohol consumption may contribute to dementia risk. Public health strategies that reduce the prevalence of alcohol use disorder could potentially lower the incidence of dementia by up to 16%. Our next article is in BMC Psychiatry and is titled Prevalence of Substance Use Disorder in Individuals with Attention Deficit/Hyperactivity Disorder, Associations with Sex and Psychiatric Comorbidity. Researchers used data from multiple health databases in Norway to examine the relationship between ADHD and SUDs. Of 800,000 individuals, 6% were registered with ADHD and 4% were registered with any SUD. Having a diagnosis of ADHD increased the odds of having any SUD over 4 times. The strongest associations were for opioids, stimulants, and sedatives. The weakest association was for alcohol. The authors speculate that the association of ADHD with stimulants could indicate an attempt to self-medicate. They note the presence of a psychiatric disorder further increased the odds of an SUD. This association was strongest with schizophrenia and psychosis. The authors conclude that ADHD, usually diagnosed in childhood, is associated with increased odds of SUDs, usually diagnosed in adults, and suggest that individuals with ADHD receive close follow-up for SUD prevention and early intervention. Next is an article in Science Advances and is titled Ethanol Ingestion via Frugivory in Wild Chimpanzees. This study sought to quantify chimpanzee consumption of ethanol from fermented fruit. Ethanol concentrations were estimated for ripe fruit samples collected from 2 chimpanzee habitats in Africa. The amount of fruit consumed and ethanol concentration was then used to determine the average ingested ethanol concentration per body weight. After adjusting for body mass, the amount of ethanol consumed by chimpanzees was equivalent to about 2.6 standard drinks per day for a human. The study suggests that chimpanzee dietary exposure to ethanol is both chronic and considerable. Our next article is in JAMA Psychiatry and is titled Cannabis Use Among Individuals with Psychosis After State-Level Commercial Cannabis Legalization. This brief report is a cohort study of 1,856 adults in the U.S. that seeks to understand the impact of cannabis legalization on use patterns among people with psychosis. The study data are drawn from the 2014 to 2022 Population Assessment of Tobacco and Health, a nationally representative longitudinal cohort study. Adults with a history of psychosis were included in the study. In states with legalization of recreational cannabis, study participants significantly increased past-month cannabis use, particularly after retail outlets opened. Our final article is in AIDS and Behavior and is titled Strategies to Improve PrEP Adherence in People Who Use Drugs, a Systematic Review. People who use drugs, or PWUD, continue to be at high risk for HIV infection, but pre-exposure prophylaxis, or PrEP, can prevent infections in this population. Researchers conducted a systematic review to assess interventions for improving adherence to PrEP in PWUD. Most interventions focused on accessibility, including reducing cost, while only a few included behavioral interventions. PrEP integrated with medications for opioid use disorder was highly effective with adherence rates between 80% and 97.6%. Researchers noted women face specific barriers and trauma-informed services would be beneficial. Overall, the authors note behavioral interventions were underutilized and support additional research on PrEP integrated with mental health services. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.